Good. Okay guys, Dr. Randy, I have Christine in the office. We're gonna do a full spine adjustment. Her chief complaint when she came in was bilateral numbness in her hands, forearm pain. She worked with heavy machinery and she was doing a lot of work that involved like shifting gears, and we think that's maybe what caused forearm pain, tightness, and gave her some numbness. And so we've been adjusting her full spine and then doing her wrists and doing some forearm work. So I wanted to show a video just to demonstrate how we do that. If anybody's home having numbness in their hands, pain in their elbows or forearms, we can work on that in the office. You ready?
Mm-hmm.
Okay. So she also had a little bit of a hip issue, so we're gonna do a little bit of low back first, and then we'll. Does this come up or no?
Oh, sorry.
If it doesn't, that's a. Leave it. Okay, we don't need it. We don't need it. We'll just do the drop work.
Okay.
So we're gonna do her hip and her low back, and like I said, we'll adjust her full spine, and we'll go from there. So you're right or left? I don't have your chart in front of me.
My right.
Yeah, and her right's are, you can see her hips are a little off there. Deep breath in, exhale all the way out. Good, good, one more. Very good. Okay, go on your side, facing me. So we'll give her her lumbar adjustment here. Okay, Christine, deep breath, exhale. Perfect, other side for me. Stay behind her so you're not in the video. Deep breath, exhale. Oh, good one there. Okay, hang on to the table. So before we shot, I was asking her, like, kind of recapping her case. She said she likes this hip adjustment, this long axis distraction of the hip. It's really good for hip pain, people getting pain like in their hip flexor, which we can show you how to stretch your hip flexor. But sometimes this long axis distraction that gaps that ball and socket joint really helps. It's also good for the knee and the ankle. So hang on to the table there for me. Good. Same thing, just relax your knee, your ankle, let your leg drop. Good. Cross his arms, deep breath. Exhale. Good. We got that already, very good. Let's get her neck adjusted. Were you getting headaches or jaw pain or anything like that before we started? Or was it all just your hand numbness?
Headaches and neck stiffness and numbness.
Okay. Where are we with the headaches? Still getting time to time, less frequent?
From time to time, but I don't think it's from my neck.
Okay, so just kind of motion palpating the joints of her neck. A lot of patients ask me, how do I know where to adjust or what am I feeling for? And so the answer is, what we're really looking for is a motion restriction. If you think of your spine as a series of joints, certain joints are going to be restricted in certain ranges, in certain directions, whether it be rotation or lateral flexion. So I'm feeling the tissue around the joint for any tenderness, inflammation, adhesion. Then I'm feeling for the motion of the joint. So it's not that your bone will shift out of place and I put it back in. It's that there'll be a motion restriction, a locked up spot basically, and we essentially, for lack of a better description, unstick it or move those joints through the proper range of motion. When that capsule goes through its range of motion, you get a pressure change and you get the cavitation sound. It's not your bone going back into place, it is almost a pressure change in the joint capsule. But it's very, very healthy. It means we're getting joints to reset. We're getting what's called proprioceptors to reset and mechanoreceptors to reset, which helps the healing process of the disc, the nerve, the muscle, all the good stuff that we want to happen. Okay, so just relax your shoulders for me here. A lot of patients think they can do that at home. You can't. I can't even adjust myself. I can do this and pop my neck and my back, but I'm not fixing the one that needs adjusted, that's restricted. You need an outside force to contact a specific joint that has the restriction to adjust it. You actually make yourself worse if you pop your neck a lot at home or your back. You okay?
Mm-hmm.
Perfect. Okay, come on up. Let's do the forearms and wrists. And shoulders too, right?
Mm-hmm.
Okay, lift your sleeve up there for me. So what we do with Christina is she had so much tightness in her forearm flexors and a little bit in her extensors on this lateral aspect. We just strip it down. She had tons of adhesion, almost like swelling in her forearms. So we've helped it a lot. She still has some, and we're gonna look at her, like adjusting her wrists and look into some carpal tunnel techniques for her. But this is greatly reduced. All these muscles in her forearms were so locked up, or so clenched when she first started. So we get in with some lotion, just like we do to the spine, just sort of strip that muscle down in the forearm. This would be really good for people with elbow pain, forearm pain, hand pain, not just numbness is what she came, we were working on her for. So we're kind of getting into this. A lot of people with tendonitis in their elbows, it's coming from adhesions in these muscles. So if you work on the muscle, you can get the muscle to fire and function properly, and you can really help a lot of tendonitis issues too. So we're just kind of stripping all that down, that muscle, and then we're going to adjust her wrist. Lean back like you're going to lean off the table. Perfect. And then we'll adjust her carpal bones. And then her elbow a little bit. Good. I'll do your shoulders last.
Okay.
All right, we're going to do the other one, and then we're going to do her shoulders, and she's going to be done. Same thing, we're just going to strip down the muscle. Good job, Kylie. Okay. So is that tender?
This one a little bit was, but this one is okay. That's a little tender.
Yeah, we've been doing this for a while, so we've made a lot of good progress. So again, just get into that forearm.
That's tender.
Yeah. And again, the cause of this was just the repetitive overuse from her job. Lean back away again. You better grip your hand with that lotion. Okay, shoulders, and you're done. So I'm gonna let it drop. This helps the glenohumeral joint kind of put it back into place, so to speak. And that's it. That's her forearm, her wrist, and her full spine adjustment. Thanks.